Thank you for coming today. My name is Tracy. I work here at Mind Plus Neurology. I'm the director of marketing, and I also organize events like this for our members here at Mind Plus. Today, our focus at our wellness workshop is Botox. So, Botox 101. Gable's going to teach us all about it, what it is, how it works. We're going to go through some frequently asked questions, and then end it with some research, some studies, just generally how Botox works for our patients, things that we've seen in clinic. Gable is our nurse practitioner. She's our provider extraordinaire. She works with us here in Mequon and also leads our Fox Valley location, and is there for the majority of the time. And you administer Botox in both locations. So you are the expert, and go ahead and take it away. Thank you for being here today.
All right, let's see. All right. That. All right, so let's talk about Botox. So when you think about Botox, everyone thinks about cosmetic uses of it. They're thinking they want to get rid of, wrinkles and all the lines, which is what it can be used for. But in doing so, they also found that it does have like medical uses also. So it's derived from a naturally occurring bacteria. Um, we call it Botox for short because that's a lot easier to say. Um, and in 2010, it was FDA approved for the use for the prevention of chronic migraine. So it does have other medical uses, such as like the hyperhidrosis, where people have like excessive sweating. They use it in some like spasticity or like a neurogenic bladder. But for us, we'll talk about how it pertains more towards chronic migraine. Um, we'll get into more how it works, but what it's doing is basically making the muscle temporarily unable to like tighten or spasm. And it's blocking some of the pain signals there. So who can receive Botox? So it needs to be an adult, so 18 and older. Need to have a diagnosis of chronic migraine. So that is defined as having 15 or more head pain days per month for greater than 3 months. And at least 8 of those head pain days need to be a migraine. So migraine then is severe head pain that is associated with nausea or vomiting. You could also have sensitivity to light, but then you would also need sensitivity to sound if nausea is not accompanying the head pain. Insurance, I guess one like basic rule of thumb is insurance usually has to have a trial and failure of 2 oral preventative medications from different classes. So those medications we use, examples would be like beta blockers, so like your propranolol or atenolol, different antidepressants, such as like amitriptyline, or you'll use venlafaxine, or anti-seizure medications, such as like Topamax or Depakote. Um, some insurances vary a little bit. Some will say they have to have, 3 medications that they've tried and failed. And then some people have amazing insurance where they don't have to try as many. All right, so let's dig in. So how does Botox work? So nerves in your body release chemicals that we call neurotransmitters. And what those do is they signal to the muscles what action to perform. So that would be, do they need the muscles to tighten? Do they need them to like raise our eyebrows? And what the Botox does is it's preventing that release of chemicals. Therefore, the muscles remain relaxed because they're not told to, perform their action. I guess a simple way to like look at that is once the muscles are relaxed, then those nerves therefore aren't firing, so they're relaxed. leading to less pain in this instance. So what does the procedure look like? Um, Botox, it comes in a powder form in a vial. The nurses will dilute that with saline, and then they will draw it up into syringes. So providers, like their technique varies. As long as you, in the end, are getting what the FDA approves, the 155 units, in a sense, it doesn't matter if that's divided among like 8 syringes or 4 syringes. It's how much you're getting is key there. There's roughly 31 injection sites, or we go in 7 key muscle groups. The needles are very, very small. I would show you, but I don't really want to uncap the syringe, but that's one of the syringes we pull it up in, but the needles are very, very tiny in there. And then the sites that we go into the areas will be cleaned with alcohol. We allow that to dry. And then we inject into the muscles, which are just under the skin. So these are not very deep at all. Let's see. So we can show where we go with the injection sites. So for all of these here in the top row, we have you in our procedure chair, and we will have you reclined. So we're injecting up here right above like your eyebrows and the corrugator. We'll go right in the middle. So some people that do cosmetic Botox will know that as like your 11s, but the Proceris will go there. The frontalis, so we divide that into 4 sites there, top of the forehead. We'll go on each side of your head in the temporalis. And then back in the occipital region, we go again on both sides. And then you have your paraspinal muscles there. And then we will go basically in your shoulders and the trapezius again on both sides. Patients have found like the forehead seems to be a tender area, and as well as the occipital region has also been a little more tender. However, if you're coming in and getting Botox and you're in a migraine, wherever that pain is at on your head can also be possibly a little more tender too. So Botox is administered every 12 weeks. We can get that down to 84 days, 4 times a year. That's the standard set forth by the American Headache Society. We don't give it more frequently because if you do that, there's a chance that your body will form antibodies. So then when you have subsequent injections, the body kind of attacks that and says, nope, the Botox is not going to work. They see it as foreign then. You can still get cosmetic Botox because obviously that's not what we're doing here. And so if people, want to get like crow's feet done, they can still get that. We just need to coordinate our appointments so it's done within the same 48-hour window, so we don't have the antibodies forming. All right, so side effects. So the side effects I talk about today are for when Botox is given for chronic migraine. Obviously, there could be other side effects if we're injecting in other areas for those other conditions like I mentioned in the beginning. So I expect right after administration to have somewhat of like a headache, neck ache. I guess that is a side effect, but I almost expect that. I kind of forewarn you that there's a good chance that will happen. Uh, there could be bruising at the injection site. And obviously, anytime we put a needle through the skin, you're at risk for bleeding and infection. I find that to be very minimal. We're cleansing the site. We're, looking at your skin ahead of time. We're not going to inject in places, if you have a current infection on your skin. Um, you know, I guess other things, blood loss would be very, very minimal. We're talking maybe a couple drops of blood, if that. Um, that can be, I guess, somewhat prevented, if you try not to drink alcohol the night before the procedure. Um, you know, Obviously, if you're on blood thinners, we got to take that into consideration, if we're injecting, but typically blood loss is nil. Uh, Drooping eyelids or eyebrows looking out of place. Um, if that happens, definitely let us know that that has happened. We will look into, was our technique different? Or is this something, going on like your muscle cannot support the Botox there? Also, when we talk later about like that you can do and not do after Botox, one of the things is I don't really want like rubbing the sites, especially on the forehead. If you're doing that, the Botox is going to disperse differently. Therefore, you may have one of your eyelids looking droopy as opposed to the other. You can read there too, rare but serious side effects would be like the muscle weakness, trouble swallowing or speaking, difficulty breathing. Those would be reasons that you would go to the emergency room. So I guess the other thing is make sure that if you are getting Botox, you're getting it from a licensed healthcare professional. It's probably also better if you're consistent, so sticking with the same injector. That way, you're familiar with them, but they're also, they know their technique and, where they're injecting, to hopefully minimize any side effects. All right. So who cannot have Botox? So we said adults can have it, therefore pediatric or anyone under the age of 18. You cannot have it for chronic migraine. If you're allergic to Botox or any of the ingredients in there, um, obviously that would be another reason. If you've had Botox previously, either from us, from somewhere else for migraines or even cosmetic, and you've had a reaction, that would be something that the injector would like to know about because you likely cannot have Botox again. If you have a skin infection at any of our injection sites, that would be a reason not to get Botox at that time. And then just make sure that your provider knows your medical history and especially any muscle or nerve conditions that they need to be aware of. Right. So we got our do's and don'ts. So after you get Botox, stay upright for 4 hours. You can make your normal facial expressions. So smile, raise your eyebrows, frown. For discomfort, if you'd like to put ice packs on, you can. No heat though. So ice packs, 20 minutes at a time, and then allow that area to be without ice. And like I said before, so you can have the cosmetic Botox, just we need to coordinate the appointments. Roughly the same, like 48 hours. And then the don'ts. So don't touch or rub the injection sites. It's very important for the forehead, just so that we don't, like I said, have one eyebrow, higher than the other, making you look kind of goofy. All right, don't apply makeup or lotions, for 24 hours. And then after that, you can, if you need to, obviously, people, wear makeup. If you could just not rub vigorously. So apply anything lightly that needs to be on your face. No strenuous exercise. So I don't really want people overheating, getting hot, sweating. But even refrain from yoga, even if it's a slow flow class. I just don't want head and positions that are not upright. So no like downward dog. So again, avoid extreme heat. So no saunas, don't go in the tanning bed. Um, I mean, you can go outside, but we need to be careful that you're not like out there trying to get a tan right away. Because that also goes back to can't really be putting sunscreen on because that would be rubbing on your face there. No wearing hats or helmets. So it is getting nicer out and people are, you know, riding their motorcycles, but I can't really have you put a helmet on after getting Botox. It's going to put pressure there on the sites that have been injected. And so if to lessen chance of bleeding, no alcohol the day before. You could also avoid it the day of the procedure too. No facials or massages for at least 2 weeks. They would just obviously rubbing the head, and even in your like traps, they're gonna be pushing that Botox where it doesn't want to go or faster than it needs to go. And then some of our patients use the Cephally device for their migraines, and so that's a device that goes on the forehead. And so if they can refrain from using that for 2 weeks also. All right, results. So the first time you get Botox, notice improvement. I would say roughly like day 10 to 14 that you start noticing that maybe head pain is less often and or it's less severe. Uh, but any improvement the first round of Botox, if it's, is positive. So if it's only less frequent, but the severity is still the same, that's still positive. If you're able, the migraines are less severe, that's great too. It should build on itself. So if you have improvement, we're going to do the second round and it should take effect, sooner and hopefully the results, continue to improve. So you had a reduction in head pain days. The second time around, it's even less. Um, I would say day 10 is when you kind of notice like the lines or wrinkles on your forehead are going away. Because it is the same Botox, even though we're not giving it for cosmetic reasons. It still will eliminate the lines and wrinkles. Um, let's see. We usually do at least 3 rounds of it, as long as we have seen, some improvement, after the second round. As long as, everything's not worse, we'll still go for that third round because it does build over time. It does tend to wear off. So some patients can get a full 12 weeks and they feel like, it lasts the entire time. More times than not, people are really good until like week 10. And then they start noticing that head pain maybe is a little more frequent, but still not, as bad as before Botox. But so then we're just showing clinical studies. The preempt study was saying that after 2 rounds of the Botox then, so week 24, that patients showed a 50% reduction in migraine days. And then at that same time, 1 in 4 patients actually went beyond the 50% and were at 75% reduction in their migraine days. All right. I guess we are near the end here. So here at Mind Plus, we want to, get you the right diagnosis. So, is this chronic migraine versus is this, episodic migraine? And then what can we do to treat you? So if it is chronic migraine, preventative treatments, If we have to try the oral therapies first, that is what we will do. If Botox is what's right for you, then we can try that. Uh, Still, even though you have a preventative therapy, we will, provide you with rescue medications so that you have options for when you do have a migraine. And then, as always, we have our urgent care that you can come into um, at any point in time when you have the migraine. And then we also have therapy. We offer, our vestibular therapy, our occupational therapy, with focus obviously being head and neck. And then we offer, obviously little educational um, seminars, I guess you want to call them, to help our patients so they know what is out there, what's available to them. Um, yeah. Yes. Anyone have questions?
Is it okay to, I know we can't use the Cephalate, is it okay to use, oh goodness, like the Gammacore and the, um, gosh, the new one that just came out?
Your Nerivio, are you thinking that one?
No, it's the other one that goes on your vagus nerve. The Truvaga, I think it's called.
Yeah,
Like, are those
those you
okay to
could use.
use?
Yep. So Gamma Core is going to
Okay,
be down here. And even the
okay,
Nerivio, so that's another one that's out there. That one's more on your arm.
okay,
So yes, those you can use.
wonderful.
Just as softly because it literally sits on the forehead.
Thank you.
Yeah.
Okay, I have one more question. And a comment. Everybody has complimented on my forehead. I just had my first Botox done, I don't know, maybe a month ago with Dr. B. Um, and it's definitely, I can tell it's working. My migraines are less frequent, knock on wood. Um, I still get a lot of like numbness. And so, like, some of my migraine symptoms have changed. Is that kind of normal? I mean, I went
So
off
it,
my Topamax and then started Botox. So things are different, I guess,
okay. I guess are these symptoms you had
before.
before it?
Yeah. Yeah.
Okay. So maybe, but now you're having the symptoms, but not necessarily having the head pain.
Correct.
Yeah.
Yeah.
So yeah, we could see that. So it is controlling the head pain.
Mhm.
But yeah, not these symptoms. I mean, we could also, I guess we can talk privately about that and what we
Yeah.
can do for you specifically if you want.
Okay. Yeah.
Yeah,
Okay. Perfect. Well, thank you. Thank you for
you're
taking away my
welcome.
wrinkles too, my headaches and my wrinkles.
I
Yeah,
guess I didn't realize that. I didn't realize that would also it's like a 2 for 1 kind of.
it is. Yeah, it's the same. It's in a sense the same. So that's how like some patients will come in, um, because they've gotten cosmetic Botox and they're like, so when I get it for a little bit, like my head pain's better. But so you're not usually getting obviously the same amount. You're getting a lot less. So it's not lasting as long, but they notice something and it's like, yes, so this is what it's doing. It is helping you. So that's kind of where we get one of the ideas that we can use this for the migraines.
You mentioned about hats and helmets and not to wear them for that first 24 hours, but after that, is it okay to, like, wear a baseball cap, or, like, for, like, a whole day, or would you say maybe hold off on that?
You can, I guess. I mean, I'd be cautious. Depends how, I guess, how tight it is. Um, the
Yeah.
longer you go without it, the better, so that you're not pushing, the Botox, where it doesn't need to go or quicker than it should, because it'll disperse on its own. Um, yeah.
Yeah, so we talked about pressure around the forehead and this area, but I know that it also goes into your shoulders and your neck. What about issues with that? Like maybe carrying a heavy book bag around, or like have you seen anything that
So
could
yeah, I mean,
cause it anywhere else?
I wouldn't wear your backpack. definitely that day. Those can be heavy. But even I guess like a lot of, you know, people have like purses in a sense, or we're all into those, Lulu bags, for example. So that's laying on the shoulder. I mean, so yeah, you shouldn't have that on there for the 24 hours either. Hopefully that's not as heavy. But yeah, definitely a backpack. I would refrain from that for a while. I mean, that kind of falls into you shouldn't get a massage, so no one's pushing that in there. So yeah, if you're repeatedly carrying that heavy backpack or anything,
Mhm.
I would not do that.
If one side, I know like Dr. B went in both sides. So like if one side seems to get better, but the other side maybe needs a little bit more work, can they adjust how they give it the next time? Like
So
if
we
my
can
left
a little
side's still
bit.
pretty chronic.
Yeah, no, we can adjust, a little bit, such as space, our spacing on how we give it.
Mhm.
Um, mhm, we can.
Thank you.
I'm just thinking about those side effects. I mean, I know they're rare and they're minimal, but have you come across anything serious, Gable, with the patients that you've treated?
I have not. I think we've had a few that have had like the droopy, eyelid or the eyebrow, not looking or not equal to the other one. But I think we've worked through those. And like I said, I expect everyone, you know, to have like feeling achy for that, like even when they leave, feel achy. But as far as like the serious ones and needing to like go to the emergency room, I have not.
So that speaks to the rarity of it, I
It
guess.
is rare. But I mean, I guess
Mhm.
that's also too is, if you know who you're getting the Botox from and, I guess that they know what they're doing and where they're putting it and mhm.
So what if you have a migraine the day that you're getting the procedure done and you are already experiencing head pain? Would it make it feel better at that moment or would it make it feel worse? Or would you even like have somebody go through with the procedure if they were presented with head pain?
Yeah, they can still get Botox. So what I've found from obviously just asking patients, kind of like surveying them in a sense when they're in there, is if they have a migraine, or maybe they had one, the day before and they're still kind of in their migraine hangover, wherever that migraine was located, tends to be a more like tender area. So, if they're like side locked here, they only have it on the right side. When I'm injecting the temporalis over here, that can be more tender for them. Um, as opposed to, 3 months ago when they got it and they didn't have a migraine, that wasn't as tender. But yeah, I mean, you could get the Botox and then obviously utilize the urgent care same day. And
So
so
you
we usually,
still
I guess the other thing too is we try to, if you're seeing Carrie in occupational therapy, we tend to have her appointment first before the Botox. So that, because like I said, after the Botox, we don't really want any massage or careful how you're, moving and where she's, touching your head or neck. So we usually have her go first for the appointment.
great. Okay. And if anybody wanted to pop anything into chat, feel free to. Otherwise, I think we'll wrap it up in a minute or two.
And you can always message in with questions like in your portals too, if it's not something you want to ask
Hmm?
to the group.
Yeah, absolutely. Patient portal, you can give us a call, send us an email. I don't see anybody typing, so I guess that means we've done it. Answered all the questions there ever were about Botox. Good job, Gable.
All right.
Thank you
Thank
for
you,
doing this for
everyone.
us.
Thank you for coming.